Have you ever felt tingling or numbness in your hand, making it hard to hold a glass of water or type on a keyboard? It may seem like a minor inconvenience, but for many, this could be a sign of something more serious: carpal tunnel syndrome. In this video, we'll dive into the clinical anatomy of the hand, understand the carpal tunnel, and explore how this common condition develops. Whether you are a medical student, a healthcare professional, or just curious, stick around as we uncover the details that matter most. What is carpal tunnel syndrome? Let's start with the basics. Carpal tunnel syndrome is caused by compression of the median nerve as it passes through the carpal tunnel in the wrist. This tunnel is a small, rigid passageway surrounded by bones and the transverse carpal ligament. When the space inside this tunnel becomes tight due to swelling, inflammation, or repetitive strain, it compresses the median nerve, leading to symptoms like pain, numbness, and weakness. The condition primarily affects the thumb, index, and middle fingers, which the median nerve supplies. Understanding what carpal tunnel syndrome is gives us the foundation. But to fully grasp the condition, we must first explore the structure it affects the carpal tunnel itself. Anatomy of the carpal tunnel. The carpal tunnel is a compact structure that plays a vital role in hand function. Let's break it down. Floor, formed by the carpal bones, including the scaphoid, lunate, and others. Roof, the transverse carpal ligament, a thick fibrous band, encloses the tunnel. Contents: inside the tunnel, you will find the median nerve and 9 flexor tendons, including those of the flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. The median nerve is the star of the show here. It controls the thumb's movements through the thinner muscles and provides sensation to the thumb, index, middle, and part of the ring finger. Now that we understand the structure, let's examine how problems in this area lead to carpal tunnel syndrome. Pathophysiology. How does it develop? So, what exactly happens in carpal tunnel syndrome? Repeated wrist movements or prolonged use of tools that strain the wrist can lead to inflammation and swelling of the tendons inside the tunnel. This reduces the space available for the median nerve, compressing it and causing the symptoms we see. Other factors include systemic conditions like diabetes, hypothyroidism, and rheumatoid arthritis, which can increase swelling or nerve sensitivity. Pregnancy is another common cause due to fluid retention and hormonal changes. Understanding the why behind the condition helps us identify who's at risk and how to prevent it. But what do these patients experience? Let's look at the symptoms next. Symptoms and clinical presentation. Patients with carpal tunnel syndrome often describe their symptoms as tingling or numbness in the thumb, index, and middle fingers. These sensations typically worsen at night and might even wake patients from sleep. As the condition progresses, weakness can develop, making it difficult to grip objects, button a shirt, or open jars. In severe cases, you might notice visible atrophy of the thinner muscles at the base of the thumb. To identify carpal tunnel syndrome accurately, we rely on clinical signs and diagnostic tools. Let's explore these in detail. Diagnosis: pinpointing the problem. Diagnosing carpal tunnel syndrome starts with a thorough history and physical exam. Key diagnostic tests include tunnel sign. Tapping over the median nerve may reproduce tingling sensations. Phalanges test. Holding the wrists in flexion for 60 seconds often elicits symptoms. Durkan's compression test. Direct pressure over the carpal tunnel may cause pain or numbness. Key concepts. Before discussing treatment, let's highlight some key concepts to reinforce our understanding. Carpal tunnel syndrome is more common in women, particularly those in their 40s and 50s. It often presents bilaterally, though symptoms are usually worse in one hand. Early diagnosis and treatment are essential to prevent permanent nerve damage or muscle atrophy. Now let's talk about how we can manage and treat this condition effectively. Treatment and managing carpal tunnel syndrome. Treatment for carpal tunnel syndrome depends on the severity of symptoms. Conservative management, wrist splints, especially worn at night, can prevent flexion and relieve symptoms. NSAIDs may help with inflammation, and corticosteroid injections can provide temporary relief. Lifestyle adjustments, avoiding repetitive wrist movements, and using ergonomic tools can make a big difference. Surgical options. For severe or persistent cases, carpal tunnel release surgery is performed. This involves cutting the transverse carpal ligament to decompress the median nerve. Post treatment, physical therapy is crucial to restore hand strength and function. But how does this translate to real world scenarios? Let's discuss some clinical correlations. Imagine a 45-year-old office worker presenting with nighttime hand numbness and difficulty gripping objects. Physical exam reveals positive tunnels and phalanges tests, and electrodiagnostic studies confirm carpal tunnel syndrome. This case underscores the importance of recognizing early symptoms and initiating treatment promptly to prevent complications like nerve damage. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain, and eyes, visit my channel to view my other videos.